So it's been a few days since I've done one of these. I don't really know how many. It's day 49 in doing chemo. This is just coming out of my fourth cycle, and it's been actually a week today since I got my fourth cycle. And it was rough. The side effects started almost immediately and have not subsided at all, as far as just kind of going from one to the other. Indigestion's been really bad. My insides, my guts, have been really bad this time around. The nausea, the hiccups, the heartburn, the acid reflux, the diarrhea, all of that. And it's just getting progressively worse. So I'm a third of the way there now. Hoping I can get a few days of normal in. Brain fog hasn't been too bad this time around, but the nausea has been really bad. The pills are, I think it's basically keeping me from vomiting, but if I get up and do anything, the fatigue sets in really quick. I've got about a good hour or two in me before I'm just tired and have to rest for a couple hours. I like to stay busy because it keeps my mind off things, but when I'm busy, it makes me get tired. And just doing almost anything wears me out physically. It's just tough. The body aches were pretty bad up all the way through Sunday yesterday. Today's Monday. And I've got like the metallic taste in my mouth. Even my coffee doesn't taste good. Everything, lots of smells are making me nauseous. Freaking dog wakes me up every morning, 6 o'clock, wants to go out, trying to get some extra sleep, but that won't happen because freaking dog. Love her to death though, so she's worth it. But I've been very irritable this week. That was something that was a little different. Tried to keep that under control. It's nobody else's fault what's going on. And just generally just don't feel good, don't want to be around people, don't really want to talk to anyone, just kind of, I don't know, just not really wanting to deal with anything, and just trying to, even the loud noises are really irritable. Even the TV, the volume, I'm keeping it way down from what I normally do. Sensitivity to cold, I'm getting the tingles in my fingers all the time now, getting the tingles in my feet now. A lot of that going on. Mentally, it's been challenging. For me, I don't know. I trust doctors, but at the same point, I kind of wonder. I was talking to my brother, and he had a surgeon that was like, surgeons just want to do surgery. Oncologists want to give you chemo. And at this point, I realize it's probably a little late in the game. And in retrospect, I should have done more research. I should have talked to other people. I kind of relied on a lot of other people that I know, and everybody just seemed to back my opinion. Nobody really seemed to suggest that maybe I should go talk to somebody else. And I think in retrospect that I should have. I'm not 100% sure that I need chemo or that I need 12 full cycles. So I might actually consult with a different oncologist to see how long this chemo should carry on, because I am not about doing any unnecessary cycles. This stuff is brutal. You feel like crap for days, and I just am not interested in doing any more than I need to. So I may look into talking to somebody else to see kind of what's going on with that, and not just take the word of one doctor. They get paid to do chemo. That's what their job is. They have a whole center set up to give people chemo. A lot of people are employed there. It's a big building. Costs a lot to maintain those things. And every cycle of chemo I get is costing my insurance $3,600. Over the course of my chemo, it's going to be over $50,000 to this facility. And so why I like to think the best of doctors. I still at the same time realize that they're human beings and everybody's here to make money. You don't go to medical school for that many years just because you love helping people. These guys got to make money. And I think that they're also, due to malpractice, leaning towards always giving you treatment, always playing to the worst case scenario, and kind of taking it from there. So I don't know, I'm thinking that I might look at going and doing 8 cycles, and I'm going to I've done some research online, and it suggests that 8 cycles is good, especially for somebody like me who didn't have any other tumors, who I don't even think they can see cancer in my blood, to be honest with you. I think that they're just doing it because I've asked them that question and he said no, he doesn't know. And so the only way that they want to stop chemo is if my body starts to fail, and obviously I'm not wanting to push it that far. And I think that 8 cycles of it is enough. And I'm going to do some more research and try and find out. I don't know that I need the full 12 cycles. I think that normal course of treatment is 7. So it's getting progressively worse, and it's the cost to benefit analysis for me. It's like if I'm going to be non-functional. I honestly think that I will be non-functional by June if this keeps going at the pace that it's going, and that I won't even be able to work, and that life is just going to be straight misery. And I just have to decide, is it worth it? And what are they going off of to decide that I needed? I mean, they found cancer cells outside of my tumor. I get it. I had a microperforation, which means it was borderline stage 3, but they don't know if they can't find any other cancer in my body right now. I can see doing a precautionary chemo regimen, but not a full-blown somebody who has stage 4 chemo regimen. Obviously, I'm not a cancer doctor, but I would like to consult with some others. So I do have a appointment with my primary care provider on the 7th, and I also do know some other physicians and people, and we'll see about trying to get a different opinion on this. So that's kind of where I'm at now. I'm just having a hard time with it because I'm not 100%. I wasn't stage 3. I wasn't stage 4. I think it would be a lot easier for me to mentally go through all of this if I felt like it was absolutely necessary. That I believe it is necessary to prevent me from getting cancer down the road, but the difference between 8 and 12 is quite a bit. That's 2 whole months of my life, and I'm telling you, the last 2 months, I just see it being utter misery. I'll just be laying, I'm nauseous now, just sitting here, and eating is just an act of will at this point, and I'm forcing myself to do it because I know that I have to. I'm not drinking hardly any water. Nothing is appetizing. And I'm eating too many sweets, I'm eating too much sugar. It's not healthy for me, but nothing is appetizing. And I've got this nasty chest cough. I cough up like chunks all day. That's not getting any better. So I just want to make sure that this is necessary. And I honestly don't believe that it is. I think that once I get to 8, I think that's going to be sufficient. So that means another 2 months. So we'll see. I've got to get the oncologist on board with it. Obviously he's not. He said, nope, 12. But the way he just dismisses that, I think it's more precautionary on his side. And I think if I get a second opinion, then I'll be able to make a more informed decision. I was rushed into this, that's for sure. I went from literally the day that I got off of my physical limitations from surgery was the day that I started chemo. There was a total of 6 weeks from the day I found out that I had cancer to the day that I started chemotherapy. And when you're in that kind of situation and you're mentally being confronted with, you just went through having 10 inches of your colon removed, which is pretty traumatic. spending 11 days in the hospital, losing 20 pounds of weight, being, first being told you didn't have cancer, then being told that you do, your decision-making process isn't all there. And I think in the future, if, one of my friends or family is going through this, I'm definitely going to encourage them to get second opinions. And I really wish I had. And even if it's just for my own peace of mind, to know that what I'm doing is necessary and not just, I'm just not buying it from one guy. And I believe that they have a financial interest in seeing it. I believe that they have a liability interest in seeing it go through. They're just always going to recommend treatment. That's just what they do. That's what their job is. And I think it's a one-size-fits-all approach to a certain extent. I don't think that the regimen is tailored to the individual very much. I think that they have so many patients. I think if I was the only patient, it would be one thing. But obviously I'm not. I can't afford to pay this guy's $350,000 a year salary. And so, it's kind of where it's at. So just to be realistic about it. But that's the struggle I'm having right now, is I don't mind doing things. I'll do hard things. I don't care. I've done lots of things that were hard, but they were necessary. I don't just do hard things for the hell of it. But, so, anyway, that's where I'm at, day 49. And headed into the normal week. Hopefully things get progressively better. I can tell today that I do feel better, but I'm concerned that if I go and push myself too hard, I'm just going to fatigue out. So, try and maintain a pace that I can stand for a while. And I can tell my physical conditioning is deteriorating. I'm losing a lot of cardiovascular ability. I'm losing a lot of strength. Just not as strong as I used to be. And, this chemo it's no joke. They're poisoning you, walking you to death's door and trying not to let you go through. So, day 49, that's it for today.